Welcome back to our second episode of Board Bitesize. Today we're joined by our Chair, Julie Holder, and Chief Executive, Tracy Allen. We've asked Julie and Tracy to talk through their highlights from today's Trust Board meeting with a particular focus on people, healthy communities, working in partnership, and a focus on the future. Over to you, Julie.
I think it's been a really good day today, Tracy, because we've had a lot of different discussions, but I think we can bring back what we've been talking about to the 4 areas. So particularly around people, I think a lot of our agenda today demonstrates this priority. So our staff story, you talked about your visit with physios, my experience at the Schwartz round, the Sexual Safety Charter, freedom to speak up, and also the QSC patient story was really talking about personalised approach.
Yeah.
And it all came back to, I think you talked about it really well, about the importance of the Kindness into Action masterclass.
Yeah, and that was a theme, wasn't it? And we talked today about being kind and compassionate doesn't mean that we don't have to have difficult conversations and deal with difficult things, but we're trying to build a whole set of tools and policies and approaches that give us all the confidence to be able to have the conversations we need to have in the way that we want them to be, respectful, kind, and making a difference. And I thought the staff story about support for a newly qualified nurse and the challenges that she was having moving it from being a student into a proper registered nurse in the community was really brilliant, because it brought to life so much about what makes us DCHS. People feeling comfortable to say, I'm not okay, I need some help, and then seeing that all these different tools could be wrapped around that person in the way that they needed them to be wrapped around. And what a brilliant success story. We've retained a fantastic community nurse in DCHS. She's got her good health back, and she's clearly lucked out because she's got a great manager. It brought it home to me that, because we had the newly launched staff forum meeting yesterday, and one of the things there was about how we can be more consistent in the support we give to newly qualified professionals coming into DCHS, and also the support we can wrap around people moving into management roles for the first time. And I thought the conversation today that Louise led showed the absolute importance of both those things.
And it's about having confidence. It's about knowing what's available to you, but having that confidence to actually start that conversation. Yeah. And that's the most difficult bit of it.
Yeah. And then in terms of our second strategic theme around healthy communities, I think we talked a lot about the contribution that DCHS services had made to keeping people well and safe over the winter, didn't we? The work that teams do to keep people independent and well at home, the work that teams like our urgent community response and the UTCs do when we've got an escalation in our health needs to make sure we don't have to go to hospital. And then, of course, the fantastic work teams are doing with local authority, voluntary sector colleagues to support people getting out of hospital and back. And I know that DCHS has made a really, really strong contribution to Joined Up Care Derbyshire managing the winter much better, actually, than lots of other places in the country. We've had real pressure around respiratory illness, COVID and flu, plus the strikes. But actually, everybody has worked really, really well across the whole system to make sure that when we need urgent care, an ambulance can get to you relatively quickly. You won't have to wait too long outside a hospital. You can get into ED, and then if you need it, you can get into a bed. So I thought that was great. And then we've had COVID and flu. We also talked, didn't we, about the growing concern around measles, and people will have heard the national concern, but the measles, the centre of the measles outbreak is the West Midlands, and we're very close to the West Midlands, and we saw COVID sort of leak up, didn't we, during the pandemic from the West Midlands. So it was good to hear Michelle talking about how brilliantly our GP practices and UTCs have responded to that risk. We haven't had any confirmed cases, but we've had a couple of potential ones, and teams have responded brilliantly with all the right infection prevention control. So it was good to hear that work about protecting everybody in the community.
And I think what we were doing is you could hear we were taking learning from the West Midlands. I think it's a good point about how we saw through COVID how it was moving around the country.
Yeah.
And it was often followed in terms of the West Midlands.
Yeah.
I just wanted to go back as well to say all of the good work around discharge. One of the things that has really helped is us being able, and Dean's been leading on this, is being able to provide data that's showing how each of the pathways is performing. And I think that's really, really powerful. The other one I just wanted to mention was where we've got real concern, and we expressed as a board that we're not happy about tier 3 weight management. And we're very clear at the end of board today that that's not an acceptable position, and we're continuing those discussions.
Yeah, no, absolutely.
Again, there was lots of things where we're working in partnership, we're showing that. But I think earlier this week we had our meeting with chairs and chief executives of Provider Collaborative. And Tamsin gave the same paper that we received at the beginning of the week. And it really shows how we are individually with one or two organisations working in partnership to improve services. And I think that's really important as we go into the 24-25 planning round. I think also the 23-24 plan highlights the areas where we're working together and what we've actually delivered in partnership. And what we're doing as we go into 24, we've already talked about pathway 3 and our fragile services and tier 3 again, and wound care. And we picked up about at the end of the meeting today about the need to support wound care to create the space to be able to think about how they can do things differently.
Yeah, no, absolutely. And I think you make a good point, because it's that the partnership working between ourselves and the two local authorities has come on enormously in the last year, hasn't it? And Dean talked about how closely colleagues from DCHS are working with local authority and with people in the acute trust to really form one team supporting people in and out of hospital. And then on the provider collaborative, you know, how are we working with the other foundation trusts in Derby and Derbyshire? As you say, I think we've got clearer that we don't have to just do things all together for the sake of it. We need to be putting our energy into where 2 or 3 of us can make a bigger difference by working together on something than doing it individually. And of course, the work we've been doing with Derbyshire Healthcare on neurodiversity services it's been really hard work. But we heard today that we're making really good progress on that, didn't we? And then Darren was talking about the work on the People Services Collaborative and how, again, if we pull together, we can make sure that we've got really good support around training, education, around recruitment and retention. We can reduce the costs of employing people and re-employing people and people moving across organisations, and actually make Derby and Derbyshire the place that people want to come and work. So I thought it was very positive.
I think as well, when you think about working in partnership, what we started talking about at the end of the board this afternoon was around partnership within DCHS. So we talked very much about wound care and podiatry and working together. So that is about the same principle. It's not just about external organisations as well. I think the one thing to just remember that we talked about quite a lot today was the financial pressures that we're facing as the NHS within the system as DCHS. We can't forget that local authorities are similarly, if not worse in some cases, really facing difficult financial decisions, and that ultimately the double whammy, if you like, of NHS and local authorities, the impact that could have on services and for our population.
No, absolutely. And then, of course, the final strand of our strategy around being future focused, there were a couple of bits that were very much about that. We didn't spend time talking about it, but we did have a green plan update, you know, in terms of the really good work going on around the trust about our environmental sustainability. And then I think, as you've alluded to, a big focus was on being financially sustainable in the future and the real pressure that we are under in the NHS and the local authorities around money going into next year. So we know that we're going to have to make some really difficult prioritisation decisions as a system about what we can afford to do next year. And we're just starting on that work, aren't we? The thing I thought played well into that was the rollout that we've got going on around Power BI and our patient level costing information system. And that is going to do exactly what you've just said that Dean's been able to do around discharge. It's going to put really good information right in the hands of people delivering services across DCHS, so they can see where they're doing well, where the opportunities are to improve, to increase effectiveness, to increase efficiency, to improve outcomes for patients. And you're bang on that the discharge improvement has been accelerated by everybody having access to good information about what's actually going on, and then having a bit of time to think about what's that telling us that we need to to do differently and keep doing more of. And the Power BI plan is that, you know, you and I don't sit looking at that information, but we roll it out so that every service and team has got access to that information. The more they can see it, the better the data quality will get. And Jim was talking about that, wasn't he? But really, this is about giving teams the tools they need and want to continue to improve the quality and the efficiency of the services that they've got. And that is going to be even more important going into next year than it's ever been before.
And the other one is around estates utilisation. So we heard about our own refresh of our estate strategy, but also that feeds into Joined Up Care Derbyshire, because the potential for better use of the estate is just critical to finance, but actually again about making better services across the piece, really.
Across the piece, yeah, no, absolutely. So I think overall, you know, there was a clear thread right through the board meeting linked back to our strategy. There was a good balance, wasn't there, about things that we're doing within DCHS and then how we're linking across with other organisations. And I hope that people who didn't get to be there but listen to this summary can see the link between what they're thinking about and dealing with day to day and what we were talking about earlier today.
Absolutely.
That's all for today's episode. We'll be back in 2 months' time after April's public board meeting. And don't forget to let us know what you think of these board bite-sized podcasts. We'd really like to hear from you. Just get in touch with the comms team or contact Tracy or Julie directly. Thank you for listening.